Hi guys, we are group 3 and we chose case 35 for this assignment. We're going to start off with introducing the case study that we chose, as well as the medical concerns revolving this case, the signs and symptoms of that diagnosis, and how we would treat it, as well as an additional role play at the end. So we had the case of a 73-year-old man who was brought in because of his memory. Some background about him: he was an engineer. And so some of the symptoms that they've brought in is that he's wandering. He's been brought back by neighbors, but he becomes defensive, upset. And he's also began to have trouble doing some ADLs. And so he got some examinations done. And so we're going to move forward with what we take away from this. So his diagnosis was Alzheimer's disease. And Alzheimer's disease is a progressive neurogenic disorder, and it is most common cause of dementia in older adults. Some of the core characteristics of Alzheimer's disease is that there's a gradual and irreversible decline in individuals' memory, executive function, language, and some of their visuospatial abilities. Their symptoms can become more severe and interfere with their daily life. Example might be, like he said, he's having trouble dressing himself and such. And it leads to an increasing dependence on the caregivers as the disease progresses. There's a loss of neurons and synapses, especially in the hippocampus and cortex, and it has progressive brain atrophy. So some of the relevant concerns in this case that signify that it is Alzheimer's is the memory loss, some of the disorientation, the executive function impairment, and his difficulty with the daily living. So, for example, they had mentioned he gets lost in the neighborhood he's lived in for over 30 years. And so the disorientation kind of signifies, like, when he's saying he's being found wandering and unaware of his surroundings, that's alarming. And he's having difficulty doing things like balancing his checkbook. So just some of those skills that are used in day-to-day life, he's beginning to show more signs of trouble. He is also showing signs of defensiveness and frustration. He's in denial, and so he says he was just exercising as he was getting lost in his neighborhood. So some of the findings that were found on the assessments that were completed were that his MMSE score was 12 out of 30, and that's the mini mental state examination, I believe. And it just indicates that there is a severe cognitive impairment with his performance. There's signs of brain atrophy, like non-extreme. This is consistent. So what they found on the CT scan is consistent with Alzheimer's progression. And then the normal metabolic workup rules out the reversible cause of the vitamin deficiency, thyroid issues, or infection. Yeah, so that's kind of a background into the medical side of his diagnosis.
Alrighty, so I'm going to be laying out the signs and symptoms for Alzheimer's for you guys today. So, excuse me, according to the Alzheimer's Association, there's 10 early warning signs that you should look out for. These are obviously more than just like presbyopia or typical aging. They can interfere, like Faith said, with daily living activities and your thinking cognitive skills. So first and the most often noticeable sign is memory loss that disrupts daily life, like forgetting recently learned information or asking the same questions over and over again. You might also see difficulty with planning and problem solving. This can involve trouble following a recipe, or if the bills, difficulty managing, the bills that used to come easy to you. Another key sign for this case of this gentleman with Alzheimer's is struggling to complete familiar tasks, maybe such as driving to a well-known location, or remembering the rules to a favorite, game or hobby they used to do. Like Faith said, like he couldn't figure out where he was in the area, so he couldn't remember where he was going. People also maybe become confused about time or place. For example, you may lose track of dates and getting lost in your own neighborhood, as I said. There can also be trouble understanding visual information. This can involve reading, judging distances, recognizing faces. This can even sometimes lead to some accidents. And then language can also become difficult within Alzheimer's as well. They may have trouble finding the right word that they're looking for or repeat themselves in conversations. Often what happens with this is they'll be, and they're circling around to find that word. That can be a common sign of Alzheimer's as well. Um, the often most frustrating symptom of Alzheimer's is misplacing items or not being able to retrace steps in order to find them. For example, maybe putting your keys somewhere that you would never put your keys, like the refrigerator or the bathroom or something like that, and then you cannot find them. Poor judgment in tandem with that might show up, and unusual like financial decisions, or lack of hygiene, lack of grooming. Um, Additionally, someone might withdraw from work or social activities, kind of isolate themselves, possibly because they're aware that something's wrong. And this can come with an embarrassment upon themselves, not wanting or being overwhelmed with what's happening to them. Finally, there are changes in mood and personality often. People may become confused, suspicious, depressed, easily upset, frustrated, obviously very understandable with what's happening to their cognitive state. And these symptoms vary from person to person. Not one person is the same in Alzheimer's. But if you notice any combination of these symptoms, it's worth taking a look to a healthcare provider. And early detection is key in Alzheimer's because it can lead to better care and more time to talk about the future. All right.
All right, so now we're going to look at the management. So for medical management, the first step, and I apologize if I say any of these medications wrong, but the first step is to begin an inhibitor such as donepezil. So these medications can help slow that cognitive decline in these individuals, especially in the early to moderate stages of Alzheimer's. As symptoms progress, especially in these moderate to severe cases, memantine may also be added to add that support of memory and function as well. It's also important to schedule regular follow-up appointments to track the patient's response and monitor for any side effects. So in terms of safety and supervision, this patient specifically is already wandering and getting lost. So it's important to have that 24/7 supervision, or a structured living environment, is essential for this patient. There's also such thing as a wearable GPS tracker. It can be provided and that's added safety in case he leaves the home unsupervised and the caregivers aren't quite sure where he is located at. And finally, driving needs also need to be evaluated because given just his cognitive deficits, it may be time to start the process of like kind of ending driving. Thanks, Ava. All right. So in terms of legal and financial planning, that should kind of start soon, kind of be in the first stages, for this patient, because it's important to discuss the directives, power of attorney, and the guardianship while the patient is still kind of cognitively aware of everything that's going on, and he can still participate in these decision-making processes. It also is important to help his wife access these types of resources to manage both the medical and the financial responsibilities that comes with being a caregiver towards a patient with Alzheimer's. Looking towards family and caregiver support, so referring to the wife as the primary caregiver support, we can also give to her caregiver support groups. This can help kind of reduce stress and just allow other people to kind of be there to talk to her and let her know that like she's not the only one that's going through this alone. Especially education is a super important one. Just to kind of explain as the disease progresses, what to kind of look for regarding behavioral. And lastly, we need to monitor the patient's overall health. This can include looking for or screening for depression, checking nutrition, making sure he's getting all the right nutrition that he needs on a daily basis, monitoring his sleep patterns, and managing any other medical conditions that could impact his quality of life. All right. Lastly, we're looking at the intervention for this patient. So cognitive and behavioral interventions can really help manage day-to-day confusion. So setting up more structured daily activities and routines can provide that patient just knowing what he has to do on a daily basis. We can also use simple memory aids. Those can include labeling photos, large calendars, or pill organizers. So if a patient becomes defensive, it's better to redirect the conversation and show them rather than kind of just saying like, no, that's not right or something. So looking towards occupational and functional support, referral to occupational therapy can help him relearn daily tasks like dressing himself or yeah. So tasks should be broken into simple, step-by-step instructions. So that can include laying out clothes in the correct order for him to get dressed to. Lastly, looking at monitoring the environment, just to support his overall safety, just because sometimes he's not cognitively aware, so he may not be sure that everything is safety, right? So this can include locking doors or adding alarms to prevent wandering and reducing that fall risk by using more non-slip rugs, installing like grab bars like in the restroom or shower, just so he won't slip in the shower as well. All right. Lastly, for the intervention, we're looking at psychoeducation and emotional support, and helping both the patient and the family adjust to this diagnosis as it is long term. It's important to validate the patient's emotions, and also just encourage purposeful activities that still kind of feel familiar so he's not really losing out and doesn't feel like left out. So some more basic ones include walking, playing music, or simple hobbies that can improve the mood and reduce frustration for these individuals. Lastly, we should also connect the family to community resources. So that can be such as the Alzheimer's Association, adult day programs, or also home health services. So these supports can ease the caregiver burden and also help maintain his quality of life. And then here's our references, and then now we are going to be doing the role play scenario.